All right, we'll get started. It's 10 o'clock. Hello, everyone, and welcome to the HEAL Community Study Learning Collaborative. My name is Lisa Romley, and I am the Education Program Coordinator for the HEAL Study. We are here today to discuss and learn ways our faith communities can increase the awareness of addiction and how faith communities can provide support to individuals with substance use disorders that foster long-term recovery. This is an important topic that is affecting our communities everywhere. We are honored today to have our panelists here sharing their innovative ways in which they are responding to the crisis. So before we get started, I just want to have a few housekeeping announcements. Just a reminder that this session is being recorded. And if your screen name is not your full name, you're using a partial name, or you're calling in on your phone, I'd ask that you change it to your full name. This just helps when we compare the participants' names in the session to our registration list. We are offering CE credits for the session. One CE credit has been approved for physicians, pharmacists, nurses, social workers, and licensed and drug and alcohol counselors. And at the end of the session, I'll give you instructions on how to obtain that CE credit. We ask that you stay on mute throughout the session, and that helps reduce any echoes or extraneous noises. And if you have any questions, and we do welcome your questions, please use the raise hand feature you'll find on when you click reactions and then click on the raised hand, or type your question in the chat box and we'll read it sometime during the session. Just to announce that all our panelists have stated they do not have any relevant financial relationships to disclose. The practice gaps that we have identified is finding a supportive faith community is essential to individuals in recovery. However, stigma based on misunderstandings about substance use disorders can be an obstacle to the individual's recovery path. And the educational needs we'll be addressing is many faith communities are eager to take a compassionate approach to supporting individuals with substance use disorders and need the guidance in learning how to implement best practices. Our learning objectives will be discussing ways faith communities can increase the awareness of addiction, discussing best practices related to addiction that provide support, and explain ways the faith communities can provide support and foster recovery. And then hopefully at the end of the session, you'll be able to implement best practices that provide support and foster recovery, and recognize ways faith communities can act as lifelines to those individuals with substance use disorders. So we are very pleased to have today with us faith community leaders serving as panelists for today's session that are bridging faith and science to address the addiction crisis, reduce stigma, and provide education within the community. So what I'd like to do is have each of our panelists introduce themselves and provide an overview of their efforts in addressing the addiction crisis within their faith community. And let's start with Mother Lori. Can you introduce yourself and provide an overview of your efforts?
Good morning, I'm Laurie Brock. I am the rector, senior pastor of St. Michael's Episcopal Church in Lexington, Kentucky. I've served here about 11 years, and this has been a faith community that has long recognized the need to meet people who are living with addiction and their friends and family members, and people who are living in recovery in their faith needs. Long before I got here, St. Michael's welcomed 12-step groups, and we have continued to recognize not only the importance of welcoming those who live with addiction into our faith community, but the importance of using language that is not shaming or oppressive to those in recovery, and also the need to engage our community to acknowledge and respond to the needs of those who live with addiction.
Thank you, Lori. And James, would you introduce yourself and provide an overview of your efforts?
Good morning. My name is James Hunt, and I'm currently the chairman of the Hope Network. and the director of Circle of Hope, which is a JAWS program that we do with the Shepherd's House here for our court order clients that have been court ordered to our program because of substance use disorder. Our organization was actually born in 2015 out of a question that was a question asked at a Boyle County ASAP meeting, was what the church could do to help this. I wasn't even here in Kentucky, I'm retired military, but through that whole process, we have had maybe 15 different churches from different denominations, which in our little rural county, when you get Pentecostals and Baptists and Presbyterians and Methodists all working together, that has truly been a blessing. And our whole bottom line as we target addiction is just to live out God's love. As we said, God's love doesn't discriminate and addiction doesn't discriminate either. So we as a faith community, I truly believe, and we believe we have an obligation to live out God's love without freedom of judgment, criticism, or whatever, but creating a safe community for those who are dealing with substance use disorder, that they can have a safe place to be able to share those the things that they're dealing with. So that's been our whole goal, is to help, to really minister to that need by living out God's love. And that's what we try to do on a daily basis.
Thank you, James. And Pastor Kent, would you like to introduce yourself and provide an overview of your efforts? Oh, you're on mute.
The refrain of the 21st century, you're on mute. I'm Kent Gilbert. I'm the pastor of Union Church in Berea, Kentucky, so a small central Kentucky town, but with access to, of course, the wider Bluegrass region. I also serve as the chair of the Justice Commission for the Kentucky Council of Churches, which is 11 different denominations. Like James said, Catholics and Baptists and Presbyterians and Methodists and all of us working together. We work together on issues of social services and trying to bring about some changes in the Commonwealth that would benefit all citizens. And the opioid crisis has been a huge thing that has been consuming all of our congregations. So I hope to bring some of that perspective as well, both at the church level where I serve as a local pastor, and then as we do work with legislators and other community activities.
Great. Well, thank you, Kent. And Catherine, would you like to introduce yourself?
My name is Catherine Getz. I'm a lay member of Holy Spirit Parish, the Newman Center at the University of Kentucky. Our parish is one of 26 congregations engaged in a collaborative effort to address serious community problems by means of social advocacy. We call our organization BUILD, which stands for Building a United Interfaith Lexington Through Direct Action. Each year, we listen to the stories our parishioners tell about the social problems that affect their families, their friends, and their neighborhoods. An issue such as substance abuse is chosen by a majority vote of the congregations. For the next 6 months, we research the problem by interviewing local leaders, consulting national experts, and learning of remedies that have been successful in other locations. We identify the official who has the power to alleviate the problem, and we recommend possible solutions. We engage the official, and we engage the official to attend a large assembly of concerned citizens who support our initiative. At the same time, we're mobilizing our congregations to attend the assembly, which in Lexington can involve as many as 2,000 people. Our power is in our numbers. When 2,000 citizens are urging the official to change a system, it can be a powerful experience. Sometimes we get a yes. If not, we continue the campaign by developing our power base, seeking allies in the community, and sometimes refining our position. It took us 2.5 years to get the Fayette County Health Department to expand their needle exchange program, but we believe in our work and we are persistent. Thank you.
Thank you, Catherine. And Dickie, can you introduce yourself and provide an overview of the efforts you've been doing?
Yes, thank you. My name's Dickie Everman, and I'm recovery pastor at Calvary Christian Church in Winchester, Kentucky. I've led a Celebrate Recovery ministry for 14 years. I've been on staff for 10, and I'm also the Southeast Regional Director for the national team of Celebrate Recovery. I have about 60 state reps in 9 states that help churches start a Celebrate Recovery. And Celebrate Recovery is a Christ-based recovery ministry. And it is a 12-step, and they call it a 12-step 8-principle ministry. I'm also on the board with ASAP, the Agency of Substance Abuse Policy. And, one of the things that we do is I'm in recovery myself. My sobriety date from drugs and alcohol is May the 5th, 1996. And it's only by the grace of God that I can say that today. And continually working my program and offering help for others. So thank you.
Thank you, Dickie. Yeah. So we know finding a supportive community is essential to recovery. However, stigma based on misunderstandings about substance use disorders can too often stand in the way of faith communities' willingness to provide critical support and connections that the people need. So Lori, I'm going to ask you, can you speak to the ways you've increased awareness of addiction as a treatable chronic medical condition, not a moral failing?
I think, and I will speak from the aspect of the Christian church, I think the Christian church has a great deal to repent of in this area, because we have and continue to label addiction as some kind of moral failing. Like if you were a better person, then you wouldn't be an addict. Instead of recognizing that, I don't know of many churches that if somebody came forward and said, oh, I've been diagnosed with pancreatic cancer, their response would be, well, you should just have been a better person. You should have been a stronger person. So one of the things is I think churches have to really pay attention to the language we use around addiction and recognize it again for what it is, that it is an illness. It is a physical response of the body. And just like almost every other illness that, humans experience, that illness has an impact on friends and family members. So, part of it is I think churches have to recognize that we are called in love to help those who are ill, who need help, to heal the sick. And in that, I think one of the basic ways churches can do that is to pay attention to the language we use around that. Do we forgive addicts of sin, or do we help them heal? Do we open our spaces to 12-step meetings? The number of phone calls I get regularly from 12-step groups that cannot find a place to meet because churches do not want them there. I mean, what a terrible message that sends. We do not want people who are living in recovery in our space. And I have no idea why. I think also the fact that churches can talk about addiction is important. It is not a shame. I mean, there's so much shame that's around addiction. And I think to be careful and to pay attention to the language we use around addiction, that we remove the elements of shame from that. And we make it something that our members and parishioners and community members can say, my father is a recovering addict. And that's not looked at like, oh, bless your heart. It's, oh, how can we continue to help? And I think, at the end of the day, one of the things that faith communities can do, and I hope that we've tried to engender here at St. Michael's and in other churches that, we work with, is to say, how can we help you? What do you need us to do? 9 times out of 10, information is a very key factor. So sharing information with members. How do you respond to somebody at a holiday party who says, oh, I don't drink? Do we need to ask them why? Or do we just say, oh, well, here's our attractive non-alcoholic alternatives? When you have a gathering at the church, do you make sure that your non-alcoholic alternatives isn't just tap water? If there is alcohol at a function, is that placed away so it's not kind of in the center of things? So I think part of it is being aware, removing language of shame, and then also asking people who are living in recovery, who are in relationships, with addicts, how can we as faith communities help and listen to the answer?
Thank you, Lori. And James, can you speak to ways you've increased the awareness of addiction as a medical condition, not a moral failing?
So one of the main things that we've done as the Hope Network, we do have 4 tenets that we do as we target addiction, which is prevention, intervention, restoration, and reconciliation. And through that prevention is like we have mentors that actually go into the schools to help educate the kids, if they believe it or not, through Kids Hope USA. But one of the greatest initiatives we started probably about 3 years ago was a pastors or faith leaders lunch and learn. So once a quarter, we have faith leaders to come in and we talk about topics that around substance use disorder, because we truly believe education plays a key role in the church folks. Because as I say, church folks sometimes we can be the most judgmental, but I believe as we begin to educate the leaders in the church and challenge them to be able to speak freely on this, as Laurie said, that, you know, even if it is amorphic, Jesus still died for this. You know, so us in the faith community, if we are expressing that love for Jesus Christ, it doesn't matter. Disease, he was wounded for our transgressions, by his stripes. So it all goes into this gospel that we say we live and preach and we want to live by. So our faith community, so part of that is educating the faith leaders in our community through this pastors lunch and learn. We call it the pastors lunch and learn, but it's open to pastors, lay leaders, community leaders, where they can come. We provide the lunch through the Hope Network and the Boyle County ASAP, where they can come and do lunch and just have some discussions about it. In 2016, we had 12 overdose deaths in Boyle County within a 2-month period. So these pastors having some of these funerals, they were still ministering to some of these loved ones. So how much more would it be to be able to make an educated discussion about substance use disorder? So that has been a passion of ours through this lunch and learn, just to educate. You know, education is power, right? We often say education is power. So much more, I believe, because many of the clients that we deal with, they don't want nothing to do with the church because they have been offended, they've been wounded, and that should not be our testimony. That should not be the church's testimony, where we have wounded the same people that Jesus died in love for. So just educating people and leaders on that through our pastors lunch and learn has just been positive. Of course, COVID kind of you know, we had to redo things, but I can't wait. I can't wait for us to be able to get back to continue to educate and we've had great response from some of our local pastors. Not all pastors involved, but we will keep boots on the ground, a military term, to keep ministering to this need to educate our faith leaders that this is a call. I believe Jesus would visit the well. He would go there and help, you know, minister to this need that so many of our people in our community needs. But our pastors lunch and learn has just been phenomenal, where we take that time to educate faith leaders on the science and the cause of substance use disorder.
Thank you, James. And Catherine, can you speak to ways you've increased awareness of addiction?
We know we'll always have people who look down upon addicts, who see them as weak, immoral, lacking self-discipline. And my first line of defense is my faith. A few years ago, we used to hear a popular refrain, "What would Jesus do?" Jesus consistently reached out to people who were hurting, the poor, the widow, the orphan, the outcast, the sinner. Are we not commanded to follow that example? In Build, we frequently talk about self-interest. If faith does not appear to be a primary motivator, what does? If officials are seeking re-election, do they want the support of voters? If the health department is charged with public health, is the commissioner interested in getting dirty needles off the street? If my neighbor has a son who is a drug addict, does he want to see his son in treatment and have a chance for a restored life? My neighbor might be interested to know that people who go to needle exchange are 5 times more likely to enter treatment. And people are beginning to develop a more enlightened attitude about addiction. They understand that addiction stems from a genetic predisposition and that adverse childhood experiences contribute to the likelihood that young people will turn to alcohol and drugs. Many drug addicts have underlying mental health problems and are self-medicating with alcohol or drugs. in an effort to feel normal. Lastly, I'd like to point out that many of us are addicted as well. Our nation is rife with workaholics and people with addiction to food, clothes, cars, video games. Could we not have the same compassion for substance abusers that we have for our own compulsions?
Thank you, Catherine. And I just wanted to mention here, there is a guide I think the NIH put out and created where they have recommended terms that help reduce stigma and the negative bias when talking about addiction. And I'll share that guide with you later in the session and in a post-session email. But I think it's very helpful because we know words matter and can have that negative impact and be a barrier to recovery. So just as a reminder, if anyone has any questions, please put your questions in the chat box and we will read them sometime during the session. So addiction and isolation are typically seen together, and connecting to a supportive community and reestablishing strong relationships are essential elements to long-term recovery. Ken, can you share ways that you're opening your doors in your community and providing that support and connection?
Yeah, I think that that's a critical point, and other speakers have already highlighted that stigma divides us, pulls us apart, and Christian communities are supposed to be just that, communities, which has been difficult, I think, both in terms of pandemic as well. Some of the things that we've done in a very practical way, as we have tried to support our AA groups and NA groups as they have entered this pandemic phase. So we've purchased equipment that's made it possible to have hybrid meetings. We've made sure to make our Zoom accounts and things like that available and provide some expertise. Simple, like we were doing that anyway for other church activities. It was an easy step, and it's the thing that I think many churches could easily implement in terms of helping others in addiction. Another thing that I was thinking about along these lines of practicalities comes back again to faith leaders, and I think James, you made a good point about the lunches and learn. You know, the last thing you want is if a church family member comes and says, "Hey, our daughter has really gotten into trouble. Is in the midst of this addiction. Pastor, what are some of the resources?" The last thing I want to say is, I don't know. And so being educated and finding the community resources that are close to you or in the areas so that you have a list. I mean, I have a file folder. These kinds of resources make it easy so that they're going to come to a trusted person. They're going to come to a church family for support. Be ready. Let's be ready to be supportive. Let's be ready to have the places where there might be addiction recovery resources. But then also the third thing that we've tried to do in several cases is we've put together a little nurture and care team when a family is in crisis, whether it be a death or in the case of addiction, a family crisis like this. And that's a small team of people who are just there to help pray through all the difficulties, just to walk with them. I think one of my colleagues said to sit in the belly of the whale. These are not trained counselors, and we're very clear that we're there to provide just a sounding board, encouragement, but a place where the family and perhaps the addicted person can actually talk openly about this and we talk openly about addiction in the community so that it isn't stigmatized. And we talk about it, we wouldn't separate somebody with cancer and never talk about their illness. We would in fact say, how's it going? What's the treatment like? Oh, that's been rough. Okay, what do you need now? These are some of the practical elements that we're trying to do. And on a larger level, I think some of the practical things we're doing is trying to make sure that those resources exist through support of our recovery centers. I mean, an easy thing for faith communities to do is to show up at the dinners and the support groups and to publicize the events that places like in our neighborhood, Liberty House. I want to shout out to Karen Atkins, who's here. Liberty Place in Richmond is a great recovery place for women. We want to be supportive of those things, visibly supportive. Again, reducing the stigma and also promoting for our own members how to get connected.
Great, thank you, Kent. And Dickie, would you like to share ways you're opening your doors in your community?
Sure. One thing, I was blessed to be hired as recovery pastor We started Celebrate Recovery 14 years ago, and Celebrate Recovery is like an umbrella for a lot of different hurts, habits, and hangups. And each Celebrate Recovery is overseen by their local church. So, I'm the ministry leader, but I have someone above me in the church when I first started it. But one of the things we encourage, we are forever family. Once people get involved in Celebrate Recovery and start working the program, we consider ourselves a forever family. And, we're going to be in heaven one day all together. And praise God, amen. Yeah. But anyway, the thing too is, this is where the mask comes off. It's a no judge zone. And so we don't judge people as they come in. We welcome them and we love them. And we don't fix them. We walk alongside of each person who comes in to Celebrate Recovery. Christ is the only one that can fix them and change that heart, change their mind. We want to plant the seeds and walk alongside of them. We've all been hurt in some way, whether it's by, the spouse or the son or the daughter who's been using opioids. That's one thing I love about Celebrate Recovery. It's not just for the drug addict or the alcoholic. It's for anybody with any kind of hurt, habits, and hang-ups. And probably 30% of our people who come to Celebrate Recovery struggle with drugs and alcohol. The rest is just different issues. So it's just an amazing program. And one of the things that our senior pastor, Mike McCormick, he preaches and talks about Celebrate Recovery often from the pulpit. And he has speakers come up and talk too about it, about how it's changed their lives. And one thing about it is I've had people come through my Celebrate Recovery and they've come up through our church and became deacons and there's one elder and leaders of small groups. And so we integrate them back into society, and just love them. So that's what we all need. Let love. So yeah, thank you.
Thank you, Dickie. We know faith communities can really save lives by referring people to proper treatment and helping them navigate the systems of care. Lori, can you share ways you're helping individuals either get to treatment or connect them to local resources?
I will, dovetail on what several people have said already, which part of it is education, knowing what is available in your community, knowing the contacts that you need to have. I think on some level, capacity is an issue for lots of faith leaders. Like we're right, especially in the middle of COVID, we're trying to do so many things. Know who you can call. If I am in a situation where I've got a person who needs help and I don't know who to call, I shoot an email to James and say, hey, so I think part of it is knowing who you can call to fill in the gaps. But I also think the practicalities of empowering your own parishioners in your own congregants and the community. We've done a couple of Narcan trainings here at St. Michael's, both of which were open to anyone who came. And I think what really was not shocking, but really saddening for me is to hear the people that we talked to through the city of Lexington were so surprised that a church would actually reach out and ask to have a Narcan training. We were the first faith community that they have had in the area ask for that. And I was appalled about that. Every church should be having a Narcan training. Narcan saves lives. So those are all available. The city of Lexington has wonderful resources, a wonderful committee that I'm a part of that meets regularly about what to do. And I really can't talk enough about educating people about addiction. From the pulpit, I think pastors as authority figures have to preach from the pulpit. It has to come in some ways from us as a public witness that this is a horrible situation that we can help heal the world. We can be part of that conversation. So I think the education, we did a few years ago as a Lenten program here at St. Michael's, a Lenten study on addiction. And we had speakers come in. And one of the things we did was we had a 12-step meeting that everybody who attended the program, anybody who could come. Many 12-step meetings are open. And I think that if you've never attended an open 12-step meeting, it is worthwhile to go to sort of see that community and again, see the affirmation and the validation and the immense and beautiful vulnerability that happens in those places. And I also think that it is important to, on the education part, to be able to separate education from opinion. I think we live in a culture now that values opinion as learned and scholarly, and there's not a nice way to say it. A lot of times it's not. You know, there are people who are well educated in addiction. They look at research. They have paid attention to trends. And when people who are educated and have devoted themselves to this, you know, learning about this and sharing this information, tell us as community members that needle exchange programs work, I then do not get to stand up with my opinion that says, no, they don't. Part of my call as a pastor and part of our call is to listen to people who are, as James mentioned, have boots on the ground there, and then take that educated information and share it with our community members. Share it with our elected officials. I am shocked constantly at how little many of our elected officials know about addiction and the responses to that. And as community members, I think it's important that we get on the phone, we call them, we send them emails, we show up to council meetings and say, these are important things to deal with. We do not get to let them just use their opinions. But I think, you know, and again, lift up the voices of those who are doing the work instead of being fearful, because, you know, I think fear gets in our way so much. And because we are afraid of something that we do not know, we dismiss it. So I think, you know, just going back to that education, advocacy, nice word for all that, and also responding when we can, all of us can do something. We can't do everything, but we can do something. And there's so many resources out there to help us.
Thank you, Lori. And James, can you share ways you're helping individuals get to treatment or connect them to local resources?
So once again, like I said, Boyle County, I just say we're blessed, especially with Boyle County ASAP. I saw Kathy Miles on here, and I just got to give kudos out to Kathy Miles and the relationships that we have established through the Hope Network with our community. One of the great things that we did as we talk about intervention is that we established several years ago, we wanted to have Celebrate Recoveries going on every night of the week. So basically we have Hope Network supported Celebrate Recoveries at different locations, not only in Boyle County, but that would include at Mercer County and Garrett County, which is connected to Boyle County. So by that way, people did have a safe place, and all of them are not at churches because, like I said, some people still don't feel comfortable going to churches, but we wanted to do that. And so, of course, the Hope Network, everybody that's in leadership here, we agreed to that, to be able to have these places where people could have a safe place to come. Of course, we sponsor 12-step programs, but we also support AA, NA, through our community, because we understand there are people that are addicted that are not people of faith. So we're not going to judge those individuals that decide not to go to a Celebrate Recovery. But we wanted to make sure that we had an open platform where people could come and feel safe. And of course, in our little knit community, so if a client comes to Shepherd's House, one thing, like I said, the Shepherd's House, the building that we do, that was the old Red Cross building here. The county actually worked with the Red Cross in Washington, D.C. that they would donate this building to our county so we could have a place. So here, our county leadership, our county attorney, they was involved working with a national organization so that we could have a building where people could come and do the programs that we actually doing. So we end up paying $1 for a building. So, but
Wow.
that's the reason why it's so important that we have partnerships with our community, as our political leaders, our faith leaders, our stakeholders in community that are other ministries that are dealing with that. But that's what we're trying to do, so we can, like I said, it goes back to really breaking that stigma, let everybody know that you have a safe place, because we know treatment works. And so like if a person walks, even though our clients are court ordered here, but if somebody walks off the street, everybody knows about the Shepherd's House here on 3rd Street. So if somebody walks in off the street, we're not going to turn them away just because they're not court ordered. Many days people are calling for help, families are calling for help that don't even have clients there. And so our team there at the Shepherd House, when they will refer them to Isaiah House, they'll work to see how many beds are open. So it's just us working together, because like I said, when we lost those people, those individuals in 2016, it opened up our community, and it affects everybody. Don't care if you're rich, black, straight, gay, black, whatever. Addiction does not matter. It doesn't matter. And so God's love is able to do that. So we continue to try to work together with community partners so we can have that place for those people to get it. But and then we had a mentor. We was mentoring our clients here at the Shepherd's House. A 93-year-old man was mentoring one of our clients. And through this process, he passed away several years ago, but the Hope Network has established a memorial, it's basically a scholarship. So we have agreed to pay for people's peer support training. So we have a scholarship for $1,000. That's $250,000 a year. $250. So we can pay a peer support specialist to go to get that training. They don't even have to worry about it. We're partnering with them to be able to get that paid so they can go out and continue to impact people's lives.
That's great. Thank you, James. And while you're still unmuted, there was a question specifically for you. Can you share the 4 Ps again that you did in your opening introduction?
All right. Yes. So I say our pillars of what we do is prevention, which prevention is we go into the schools to help mentor kids through Kids Hope USA. We have intervention where we do our Celebrate Recoveries once a week. Then we have restoration, which is our jobs program at the Shepherd's House. And then we have reconciliation, because we realize that there are some people and we're specifically talking about racial reconciliation, how that affects addiction also, because African Americans, our Latino communities, a lot of times they don't get the same resources that some other communities may get. So we decided to add that leg, that there needs to be some reconciliation, that everybody deserves a fair chance in addiction. So we just wanted to make sure there's no barriers, racial barriers between, whites, blacks, Latinos. Everybody deserves a free chance. So that's a prevention, intervention, restoration, and reconciliation.
Great. And one other question directly to you too is, when is the Pastor's Lunch and Learn? When are they going to convene again?
We don't, Kathy Miles kind of runs that for us, and we really haven't discussed that yet for the upcoming year. But usually we do have a flyer. We have a committee that actually plans those lunch and learn sessions. I'm not too involved in that, but we do. But once that is back on, we usually send it out through our Boyle County ASAP and a Hope Network, and we do have a Facebook page that we post all those things off. So usually we do a pretty good job, at least in our local community, of advertising, but we can always get that information out to other individuals that are interested in attending that.
Great.
But we haven't started up again because of COVID. COVID kind of changed everything. But once we get to go ahead and be able to do that, hopefully we have a planning meeting next week for our Hope Network to start looking for the next year. Hopefully we can be able to get some lunch and learns. And then another thing that we did, and I hope we through this thing, we wanted to create a safe place through we sponsor a Night of Hope at least 3 times a year. We sponsor a Night of Hope where we come together. It's just a worship and praise. It's usually through our Celebrate Recovery teams, where we pick a local church where we just come together. It's just a worship and praise atmosphere where people can find hope, and let them know you have a safe places. So that's another thing that we try to break that stigma. There's testimonies during that time of the people's recovery. And like I said, we're just trying to think outside the box to let people know there is hope, and everybody deserves that love.
Right. Thank you. I just want to add here that the HEAL community has developed resource guides for all 8 counties that we are serving. And what it does is provide individuals with local resources that are within their community. and they're available in English and Spanish. And if you'd like one of these guides, I'll give you instructions on how to receive these resource guides at the end of today's session. Okay, for the next question, we know that addiction can leave lives of individuals and their family dramatically altered by the loss of jobs, home, and damaged relationships. And we know that a person cannot recover from addiction if they are homeless, isolated, or struggling to find food and safety. So, Lori, can you share ways your faith community is supporting the basic needs of individuals?
One of the realities of churches is something that I like to call competitive Christianity, which is everybody likes to be like, look at what we're doing, isn't it awesome? At the end of the day, some of what St. Michael's does is we send money to the groups that are doing this work well. If there are groups that are doing, Greenhouse 17, Hope Center, if there are groups that are doing the work well, they've already, built the framework, send them money, support them. We do not need to reinvent the wheel, for the sake of our own egos. So that is one way that St. Michael's does that. We support the groups that are doing this work. I think another way is to respond to people's immediate needs. And, so often we kind of we want to fix somebody, but they're hungry. And, I always tell people, you cannot share the good news of God with somebody who hadn't eaten in a week. You need to give them something to eat, and then you can talk. And also the other part of that is, in the Holy Scriptures, in the gospel, when somebody comes to Jesus and needs to be healed, Jesus doesn't say, so what'd you do to get yourself in this mess? Now, I might add, the disciples do that and get in trouble for it. But Jesus himself responds to that immediate need. And then once that is taken care of, then we can get into some deeper reflection. So I think part of it is for churches, again, to respond to the immediate needs of people. Are they hungry? Do they need to know they matter? Do they just need to be prayed with? I think one of the things in all of this is we are faith communities. We believe in prayer. I think that every church, every faith community in this country, quite honestly, should be praying for those who are living with addiction, those who are in recovery, and for all of us to be a part of that healing, for that lovely word, that restoration and reconciliation of us all. The basic tenet of Christianity is to love our neighbor. And inherently what that means is that I want for my neighbor the same things that I want for myself. When I am broken, I don't need somebody to kick me while I'm down. I want somebody to say, how can I help you? And I think, what faith communities can do, on the big picture basic needs is to ask that question, how can we help? And discern what that looks like. There are some faith communities that do an amazing job with financial literacy classes, with job placement programs. There are other faith communities, and we are part of this, that make sure that every child in certain schools has food all week. So they are not going to be hungry. So I think part of that is the awareness of the needs and then responding to those needs or supporting the groups that are already doing a good job by writing that check.
Thank you, Lori. And Kent, can you share ways your faith community is supporting the basic needs of individuals with addiction?
Yeah, I want to underscore what Lori said, and I want to also take a moment of brutal honesty and say I think this is a point of some despair for myself and other pastors as well. It is never it's never the case that addiction affects just one single person and you go in and you fix one single thing. And so it's easy to get overwhelmed. And I don't think that our church or, churches in general, are always up to the task. We are overwhelmed just like everyone else is. And of course, as you've already pointed out, there isn't a single family in my congregation which is upper middle class, predominantly predominantly white, Euro-American, but in Central Kentucky, there isn't a single family who hasn't had somebody in their family or close group of friends affected. So there's the emotional components of support to those surrounding, but then there's also the things like housing. There's the things, simple housing, food, all of the things that Lori spoke so eloquently about. And not every church is good at everything. So I think one of the ways that we've tried to do is again, to target what we know we can do and to partner with those who do other things better. The part that I would want to add into that is that if every single church did every single thing that every single faith community was capable of doing, we would not be able to address this issue. There is not enough money and not enough time to do this in this sort of little local level, as much as it helps and critical as it is. We have to, in fact, engage in a variety of political activities. And I know that that is going to create some allergic responses to some of our listeners, perhaps, but churches who care cannot feed the world without the participation of systems that are large enough, involving enough of us to put that care into action. So that's one of the reasons that the Kentucky Council of Churches maintains an advocacy commission of volunteers who we work with legislators to help educate legislators who can, in fact, feed 140 million people rather than the 4 who come to the door of the church. We have to create and support policies, groups like Bread for the World, groups like AA groups and other things, but we also have to support legislation. Right now, opioid money is coming into the state from a variety of the lawsuits that are coming. It's critical that voices of faith are at the table so that legislators who will be determining where those immense, I'm talking billions of dollars of resources go, that we make sure it doesn't just go to the places that are shiny, bright, and have loud advocates. It also has to go to Eastern Kentucky, where there may not be a sexy program yet, but if there are churches who have been doing work and we can advocate together, we can direct those funds and the resources that come with them to our local health departments, to our schools, to our institutions, where we can create multi-level interventions. I know that that is a level of work that may not be immediately obvious. And it feels really, really good to go make a sandwich bag and hand it out on the street corner. And I don't think it's an either or, it's a both and. We have to be ready to support the people who come to our door with all of the faith resources and the food resources and the housing resources. But then we also have to be willing, just like in that old parable, we have to be willing to go upstream and stop the ways people are getting thrown into the river rather than pulling just one out at a time. So working together with your local governments, showing up at city councils, making sure that they're applying for these funds and doing so out of your commitment. I do this out of my commitment to my faith. Jesus wasn't just about, oh, let's each one save one. That's a great idea, but the addiction crisis is too big. We need to each one save 20, each one save 100. And to do that, we need to engage every system we have, from school systems all the way up through national legislation, so that we can support these families with critical needs.
That's great. Thank you, Kent. We know that children exposed to substance use disorders in the household or any adverse childhood experiences are at a higher rate for developing a substance use disorder. So early intervention that support families and empower youth are critical. Catherine, can you speak to the impact of adverse childhood experience and the importance of early interventions? Whoops, you're muted, Catherine.
I have a background in foster care, where I was with a team of social workers whose job it was to place children who had been removed from their homes because of terrible conditions, to place them in appropriate foster homes. And we would get referrals almost daily. And sometimes we'd have a flood of 8 or 10 in one day, which is quite a challenge. But we became quite familiar with the circumstances that children were removed from. And I can tell you this, in practically every case, someone in the family had a substance abuse problem. And if it wasn't brought up right away, if we didn't know it at the time, we just kind of assumed that that was a problem because so often it turned out to be the case. And these children need homes where they have the nurturing and the structure and the educational aspect that can help them recover. And as you know, as all of us know who have ever lived with or known a substance abuse abuser, that they can be very trying. They can be difficult people. And when they raise children, they frequently are not there physically, they are not there emotionally, or when they are there, they are emotionally and physically abusive. So these are what children have come into foster care with, and they lack a basic trust in human kindness. And they are all set to reject their new parents and reject a more normal life than what they are used to. All of us like the familiar. And probably their main goal is to recreate in the foster home the kinds of problems that they're familiar with in their birth home. And so this is a real challenge for foster parents too. And think of all the children who come from those dysfunctional homes whose mistreatment has not risen to the level of being removed by the state to be placed in foster care. So many children experiencing those adverse effects, and so much help is needed by the entire community.
Thank you, Catherine. And Dickie, would you like to talk about ways you're supporting families and empowering youth?
Sure. One of the things our church does is our youth group meets on Wednesday nights, and it's gender specific and it's age appropriate. And so it's a smaller group, and there's leaders in each one of those groups, and they can get really close to them and personal with them. And there's a lot of kids out there struggling right now. And Celebrate Recovery, we have a program that follows the same guidelines and stuff as Celebrate Recovery. It's called Celebration Place. We call it pre-covery. That meets on Tuesday nights alongside of our Celebrate Recovery. Now, every Celebrate Recovery don't have these youth groups or children's groups, but ours does have. And I think the main thing is we have to find leaders to lead those groups, But when we're talking about forgiveness in our large group for Celebrate Recovery with adults, they're talking about forgiveness in their areas too, more age appropriate. But Celebration Place is I think preschool to sixth grade or fifth grade, and then the landing is sixth grade through 12th grade. So we always, and my leaders for that just love these kids and love the youth, and we call Celebration Place pre-covering. We want to give them the tools that they can before they get that hurt in their life. A lot of them already has that hurt in their life, so we want to give them the tools to use and introduce them to Christ so that they can get through the struggles of life. Jesus said, "In this world you will have trouble. Take heart, I've overcome the world," and I believe that. And, we're going to continue to have trouble. Even kids are going to have trouble, but we can turn to Christ, and we need to be able to walk alongside our kids and our youth in order to help them deal with things that's coming up. These past couple of years with COVID has been just traumatic for them. It really has. It's been bad for adults, but it's really been traumatic for them. So I really love the landing ministry for teens and the celebration place ministry for the younger grade school. We offer childcare also for 4 years old and under. That way, the whole family can come as one and get healing, whatever their struggle is. Drugs and alcohol isn't the only struggle out there today. There's a whole lot of struggles out there. There's pornography. There's anger issues. There's codependencies. There's control. There's anger. I don't know. There's just a lot out there. And so, I just we need other people to walk alongside it, and that's what we do.
Thank you, Dickie. And Kent, would you like to answer that question, the way you're supporting families, empowering youth?
Yeah, I think I'm so appreciative of what my other friends have said, and I think again, a lot of it comes down to creating openness and transparency so that we can let kids have a place to talk about the fact that they themselves are struggling, or that their family members, their parents perhaps, or a sister or a brother. That's creating a safe space for that is something that churches already know how to do. And if we are able, I think that can be so empowering. One of the things that we've done here in particular is we identified a couple of groups that were particularly vulnerable, including the LGBTQ kids in our community and in Southern Madison County. And one of the things that we identified is that, of course, depression, substance use abuse is very, very high in comparison to an already high use in the normal population, regular population, when you add to it other social stigmas. So one of the things that we've done is we started a non-religious group, but started again out of our religious beliefs to create a safe space for young adults who are on the edge, right? Or looking for that support, finding ways to release all of that, like what Dickie talked about. The stresses of these last years have been absolutely incredible on all of us. It gets magnified 10 times worse if you're coming from a family that already has an addiction issue, if you are suffering from depression or have other social pressures on you. So we really wanted to reach out to that and work towards suicide and preventing suicide and preventing substance use abuse and providing some strength for those folks. I think all of these are, I wish I knew that these were all magic bullets, but I think that it is so critical that we all do something, that we all simply provide encouragement, even folks who don't come to these programs like Celebrate Recovery, or they don't go into a church. But if they on the outside somehow know that this is a church that cares, or they know that there is a program out there, they may not choose to go now, but we can't be silent. It can't be just for insiders. It can't be just for folks who come on a Sunday morning inside the building and receive that quietly. We have to help families, and particularly our young people, know that this is something we can talk about. There is somebody who will listen. There is a place you can get some strength, some support, some reconciliation, perhaps some guidance, but can connect you to resources. So we're not there yet. I'm not in the least bit satisfied with the way that we've been able to do that. I think we've all been disheartened by the way that, the Just Say No campaign, which was going to fix all of our children in the 80s, fixed nothing. We know that the DARE program, evidence-based stuff is that it hasn't done what we hoped it would do. So we're all still casting about, but I don't think that means we shouldn't have done those things. I think we just means we haven't landed yet on what's going to be most helpful. I tend to be a systemic person. I tend to think systemically. And so what I know is that transparency and openness and talking about it out loud and in person and from the pulpit and in family groups helps break the cycles of secrecy that feed these problems that then generate addictions and generate. So I hope that is the first step. And then every program, I want to try every program that we can support our young folks.
That's great. Thanks, Ken. We know no single organization or persons can address the multitude of services needed to help people affected by substance use disorders. And the best results are often seen when we undertake them, the actions together. James, can you share any partnerships your faith community has developed?
So like I said, our whole organization was born out of a discussion at a Boyle County ASAP meeting. So I think we were kind of born out of already the community trying to address of course, that was the heroin opiate back in 2015, but still that partnership with the Boyle County ASAP, we wouldn't be what we would be if it was not for that critical partnership that we have with Boyle County ASAP, which, you know, a couple of years ago, we started the Boyle County Health Department started the syringe exchange program. There was a lot of stigma, you know, pushback in some of our faith communities about that. You know, why are we just giving it? But just going back to that education process of us having those discussions, and now we're seeing positive results with that. But once again, it goes back, are we willing to have those hard discussions and encourage faith leaders to start thinking about these kind of issues, because it's not going away. So we can be part of the solution, or we can continue to be part of the problem. But we choose to be part of the solution. Our faith, the love of Christ, compels us to be part of the solution. And so I thank God for that partnership that we have with our board, especially with our, like I said, I'm just giving them their kudos, you know, Boyle County ASAP, and the hard work that they do on a daily basis to discuss not only substance use disorder, but other mental health issues. It's just critical that we be a part of that, and to continue to live out that love. Let's be a part of the solution.
Great, thank you. And Catherine, can you share your partnerships you've developed?
Bill, excuse me, I'll unmute.
You're good, yeah.
Build, our collaborative group of churches, voted to address substance abuse in 2018. We found that the local health department had a needle exchange program. We also learned that it was quite limited. It was open for 5 hours a week. It borrowed staff from other departments, and it had no facility for referral for treatment. Through our research, we learned best practices. And because of that, we decided to increase the scope of the needle exchange program. So we started asking the health department, the health commissioner, to increase the hours of the program, to hire dedicated staff, to provide counseling and referrals to treatment, and have the program open during hours when working people could access it, which is a big change from what they've been doing, and they resisted. They didn't see it that way. They thought they were taking care of the problem. And they showed us many detailed charts showing us how well they were doing, but we knew that the program was could do much more, and that there was a need here in Lexington. We mobilized our people, and we had an assembly where we asked the health commissioner to do more, and we had no luck the first time. We had no luck the second time, but we don't give up that easily. We thought that part of the problem that caused the health commissioner to resist was a lack of funds, and isn't that so often the case? We recommended to him that he hire a grant writing expert who could seek out government monies that might be available to expand the program. By 2020, he had done that. He had hired the grants writer. He had obtained the money. He followed all of our recommendations. Plus, he bought a mobile van so that the program could be not only at that one limited location, but the show could be taken on the road and go to other neighborhoods which had a problem. So it took us 2.5 years, which is not long in build terms, but we succeeded. and we are persistent. So we go back and build our power base. We seek allies. Sometimes we refine our position, but we do not give up easily. We are persistent, and we follow up with the organization afterwards to make sure that they are continuing the program once the heat from us is off.
Great. Thank you, Catherine. And Dickie, would you like to share your partnerships you've developed?
Sure. You know, I love what James said about, sending people to different groups, AA, NA. I don't care how you get clean. I want you to go to those groups. When I first got into recovery, I needed a meeting every day, and sometimes some places sober recovery don't have a meeting every day. But I guarantee you, there's a AA meeting or NA meeting around that can help you. And so I love that. I love that we can just encourage our participants to go seek help in other places also. One of the things we do too is on United Healthcare actually approached our church, and they approached senior pastor Mike McCormick, and was wanting to do a sort of 6 months trial for trying to help people with substance abuse. And actually, my wife, Juanita, from Achieving Recovery Together, she can tell you more about that, because we partnered, Calvary Christian Church and United Healthcare and Achieving Recovery Together partnered together with it. And it was mainly Mike and Juanita who carried that. So Juanita, would you speak on that?
Yes, thank you. My name is Juanita, and I am a person in long-term recovery, 25 years. Glad to be here today. So we partner with United Health and also Calvary Christian Church to develop a pilot for a transportation program. So it was a 6-month project. And because United Health that was one of the issues, was transportation, getting individuals to doctor's appointments or getting individuals to an MOUD appointment. So it actually showed, yes, there is a problem in getting individuals to their appointments. And if they can make it to their appointments, then there's more of a guarantee or of continuing their recovery. So from that, we have continued that transportation program. We have 3 vehicles now that we provide transportation for people in our county and surrounding counties. Sometimes it depends on where we are a recovery community organization. And so we offer transportation to people leaving jail, to people just walking into our facility needing treatment. We accept people from all walks of recovery, and we accept people from where they're at. So we still continue to this day to offer that transportation program. And it kind of started with that pilot program. So it was great for us to be part of that. We appreciated that. And we continue, like I said, to do it today.
Yeah, the church actually offered the vehicles, our church vans, to do that transporting, and Achieving Recovery Together offered the personnel and the driving part of it. So that's been just that's been a good one. Also, we partner with different organizations in our community as much as we can. Like I said, I'm on the board of ASAP here in Clark County, and it's a wonderful agency. And there's so many people in it that we can really spread the word about what's going on in our community and how to get help. They also put out a flyer of the different groups in our county that people can seek help with also. there's an association of churches here in Clark County too, where we can share what's going on in our county. And just, I think the biggest problem is communication. And we've done a good job here in Winchester and Clark County of communicating with other resources to help people struggling. We have Clark County Community Services and the Homeless Coalition. It's just so much, and I'm proud of our community too because of that. I do wish all the churches would step up a little more though.
Yeah, great. Well, thank you, Dickie and Juanita, for sharing. Appreciate that. I'm just going to stop here and address some of the questions that are in the chat box. And Susie asked, and it's to anyone on the panel here, how can someone outside the faith community as an employee of a local health department most effectively reach out and engage faith leaders? I think you all have a lot of power as fellow faith leaders that I do not have, but I recognize how effective the faith partners we have in this area are and want to expand those connections. So how do we connect to you? And anyone can answer.
We had really great success. I think growing and ongoing project. The health departments did a great job of reaching out just personally. And I think, unfortunately, the mountain of mail that most pastors and churches get simply means that a letter is probably not going to do it. But a phone call that says, hey, we're getting pastors together for maybe want to put together a lunch and learn. If the health department, when our health department has done that, they have been very well attended. They've, if there's a way to get pastors will come for food, and of course now we'll come for Zoom food.
Amen.
If there's a way we can, if there's a way, that we can get together with each other and with the health department, I think an invitation like that, I know I would be delighted to participate in those kinds of things. But it really, in fact, in my world, it just takes a phone call. It takes somebody to talk to me directly. I'm swamped with emails, I'm swamped with letters. And so I think though, that's not about willingness, it's about access.
And I think just do it. Just do it. Just take the courage and do it and reach out. That's the bottom line, as Nike would say, just do it. Just do it. Just have some boldness and go ahead and do it and reach out.
I would agree with Ken. And I think the other thing is, if probably my own, issues, but I respond much better to an email or phone call that says, here's what I need of you, than, hey, let's talk. Like, if you can call me from the health department and say, we'd like to schedule a Narcan, what works for you? I'm on. That is because part of that is just capacity at this point in COVID, because most of us are doing like 48 jobs that we weren't doing before. So if you can reach out, even if it's, I'd like to talk with you about how we could collaborate on, something. But that is so much easier to deal with than let's talk. And my sense is that most pastors right now are kind of in that space. And if you don't hear from us, call again or email again, because emails get lost. 90% of the time, we're not ignoring you. It's just that your email came in on a day off or we had a funeral or something. But absolutely, most of our collaboration has been with non-faith communities. So the health department, organization. So that absolutely is a key component of how we are helping get this work done.
Great. And one other question from Gina here is, can anyone talk about the different faith perspectives around medication assisted treatment, or the MOUDs, medication for opioid disorder?
I have several families in my church who have used this very successfully, and I'm not sure it's exactly a religious perspective, but I can tell you that their perspective has been very positive, that it has made a critical difference. Now, I don't know that I think it's for the physicians to decide whether that's a viable option for every single case, but it's certainly, I think anything that brings life back, that presents the possibility of restoration and reconciliation. It has restored in that family the ability to have a relationship again. And that boy, that just feels like a powerful pathway of God's grace to me. Now, the ideal, of course, is that eventually, this is absolutely substituting one addiction for another. It is, however, I think, a reasonable thing for people of faith to consider, given that it has the potential to lessen harm, right? And I think in a crisis, triage is critical. We've got to lessen harm. We've got to stop the bleeding first, and then we can decide what later interventions may be warranted. So we're on fire in Eastern Kentucky, right? This is not like a few people are having this issue. We have had more opioid deaths than almost anything else. It's shot up the list in terms of causes of death in the Commonwealth. So we have to take everything and anything right now that will stop the bleeding and help the families and bring about that possibility for health. So I think if on a religious thing, my thing is that to God be the glory, anything and everything.
Great. Thanks, Ken.
And
go ahead.
I would
go
say,
ahead.
in the Episcopal Church and in other sacramental churches, there are 7 sacraments. One of them is unction, which sounds like something that you would take penicillin for, but it's not. It actually is a healing. It's prayers for healing. It's laying on of hands and anointing with oil. I think it is so important to remember that a deeply held part of the church is the process of healing, not necessarily cure. And so, we are healed by so many different things. And that may mean that we have, as Kent said, you take these incremental steps back into whatever the restoration and new life look like. And however that needs to happen, and this is kind of when I go back into, I am a theologian, I'm a priest, I've been trained in trauma counseling and pastoral counseling. You don't want me to do your colonoscopy though, because I'm not a doctor. So I think that we do, as people of faith, and certainly in the Episcopal Church, this is our theology, we listen to medical professionals. We listen, and I will always encourage my parishioners or anyone who comes to me, what are your treatment, what are your people saying? And how can we support that? And again, like Kent said, are we replacing one addiction for another? In some ways, yes. And healing, sometimes healing's never a straight line. It's always kind of a mess anyway. So how are we present to healing? Because that is a fundamental sacrament of the Episcopal Church.
Thanks, Lori. And April, would you want to address the addiction treatment?
Yeah, first I have to just say that I'm so moved to hear all of this support, for different paths to recovery, and also just your passion for addressing stigma and supporting folks. I wish we could kind of spread this all over the state. And I also wanted to address what Lori had just said about listening to medical professionals. And one thing I've learned by, being part of this healing community study is that buprenorphine and methadone, I think that in the past it had been perceived as replacing one drug for another. And that's still a common perception. But I think now the medical community feels like this is like any treatment for a chronic condition. And, just like some people are on insulin for their lives, this can be a lifelong drug that is not kind of working in the brain like heroin or another opioid is. So I just want to put that out there. That's how we see it in our study, and that's how it works medically.
Thanks, April. And one other question from the chat, and then we'll kind of wrap up here is, and it's specific to James, is your organization reaching out to populations with immigrants through the churches?
No.
Okay.
No, we do. We have a discussion. We have one pastor that works with another Hispanic pastor, but that really hasn't been part of our mission. We know there's more work to be done. The Ball County ASAP works with, I forgot Latino, but they work with it, but our organization does not. So the basic answer is no.
Okay. Great questions. And so thank you all for participating in that and asking those questions. I did want to share earlier, I talked about the HEAL community has developed resource guides for each of the counties that we serve. And what it does is provide knowledge of local organizations and their link to services. And this example up here is Fayette County, but we have one for all the 8 counties we serve. So if you want an electronic copy, just email me and I can get that to you. But if you want hard copies, we can mail them to your organization so that you can pass them out to your parishioners. They're great guides. This is page 1 here that goes through all the resources and then meetings. We promote, we have a lot of smart recovery meetings. And so all that information is available there on that website. And so it has a wealth of information that is easy, that you wouldn't have readily at the top of your head. So when people ask for resources, I think it's really great. And then the other resource I wanted to mention is our HEAL community does have prevention specialists assigned to each of the counties that we serve doing the naloxone training. So if you're interested to have naloxone Narcan training done in your faith community, one of these prevention specialists will come out and do the training. Again, you just have to email me and I will connect you with the prevention specialist that works in your county. And then earlier in the session, I talked about what to say, or I talked about a guide coming out from the NIH about what to say and what not to say. I'm going to share this with you in an email. I'm not going to read everything here, but the terms on the left will create stigma, where we replace those with terms in the center there that reduce that stigma and reduce that negative bias. So there's 3 charts here, and of course, not enough time to read them through. So I will send them out in an email. Okay, so before I go into the CE credits, I do want to have one closing question to each of our panelists. Many of us want to help, but we're just unsure of what to do. So I'd like to ask each panelist in this group, what one thing or one action, one practical way each of us could help individuals with substance use disorders. And I'll start with Lori.
I'm going to dovetail on what Lisa just said. Carry Narcan and get every organization that you were a part of to do a Narcan training. It's quick, it's easy, it's effortless, and keep them in your workplace. And in every faith community, I think, should have Narcan.
Great, thank you. James.
Put some faith to your feet and get out and get in the trenches and just love people right where they're at. No judgment, just continue to love and then educate. But put some faith to your feet, get out there in the trenches and say, I'm gonna become an advocate and say, let's do this all together.
Great. And Kent.
Yeah, I'd say take that step, put your faith to your feet, but put your faith to your phone. Call your city council, call your legislator, let them know that you care about these issues. And the next time they've got an issue, you want to be involved. Call your pastor, call them up and say, hey, I've just got this burden on my heart. And I've got attended this incredible workshop and I found out some great resources. I want to just lift this in prayer in next Sunday, out loud and in front. Let's just speak it out until we can work it out.
Great. And Catherine.
I would advise anyone to form a positive relationship with the possible abuser in your life and make it a relationship that does not enable.
Great. Thank you. And Dickie.
I think you have to know what's available in your community. You have to know where to send people if they need help. And carry Narcan. Narcan saves lives. I do believe that.
Great. Thank you, Dickie. All right. So just to give you some information on how to get the CE credits, if you just need a certificate of attendance, we're going to put that link in the chat box.